We're announcing a new effort in Louisiana to do better when it comes to health outcomes related to cancer, specifically an initiative to study, get 50% or more of all cancer patients in Louisiana into clinical trials, but also to announce a Take Aim at Cancer in Louisiana initiative to improve the health outcomes of cancer patients, which right now in the United States of America, we're the fourth worst. But we have the best tumor registry in the state. So there's a huge disconnect. We know we can do better, and we're going to take advantage of a $500,000 grant that United is making to the Cancer Research Center here in Louisiana. And we're going to proceed in a much better fashion, a much more coordinated fashion, rather than having multiple efforts around the state that are disjointed. We're going to bring those efforts together, make sure that we streamline the process, cut out the duplicative costs, but actually achieve better health results for the people of Louisiana. Cancer has touched every single family. There's no doubt about that. We know that we can do better, and we are doing better in some respects. The Medicaid expansion, for example. We have thousands of people who are being screened, tens of thousands, who are being screened now and receiving diagnoses much earlier in the disease stage so that they can be more effectively treated in terms of actually treating the cancer, but also more effectively treated in terms of the cost of that treatment. So we've got a lot of work to do, and today is an exciting step to produce better results for the people of our state.
I want to thank all of you for being here, to come over to the Claiborne building and see a room full of so many people, and the quality of people who are here assembled this morning so that we can take aim at cancer in Louisiana. That is inspiring, and I am very hopeful, and I know that you are as well. And Dr. Gee, thank you for your leadership, for the introduction, and for bringing us all together to focus on a subject that has touched all of us. Maybe not individually, but some member of our family, some close personal friend. I'm sitting here looking at Julie Stokes right now, recovering from breast cancer. My first chief of staff is in the hospital today, recovering from the removal of a portion of his lung because of lung cancer, a lifetime non-smoker, by the way. And so this has touched all of us, and in Louisiana, it's touched us more than we would like, for sure. So it is great to be here. And I'm happy to welcome all of you as leaders from the healthcare, business, government, and community as we focus on cancer care in Louisiana. I also want to thank the Division of Administration for making this meeting space available to us today, and all of the elected officials who took time out of their schedules to be here. Is Mayor Sharon Weston Broome here? I know she'll be here later today, and she's been a leader on healthcare, and I'm want to thank her for everything that she's been doing. This is a priority for her as well. So I'm here today principally to announce our statewide strategy for Take Aim at Cancer in Louisiana. The United Health Foundation is here, and they have provided a grant to the Louisiana Cancer Research Center. And that is going to be very, very important and instrumental in this overall effort. And so before I get into detail about our efforts at the state of Louisiana, I'm going to invite Christy Duffy of the United Health Group, Chief Clinical Officer and board member of United Health Group Foundation, to come up and say a few words about that grant. And so if you would, please help me welcome Christy Duffy.
Good morning, and thank you to the governor and Dr. Gee for really convening this remarkable group of individuals to make a difference in tackling cancer for the state of Louisiana. As he said, my name is Christy Duffy. I'm the Chief Clinical Officer for United Health Group, and I'm a board member with the United Health Foundation. We employ over 285,000 employees worldwide. We care for more than 874,000 Louisianans, and we employ over 700 Louisiana residents. Today, I have the unique privilege as the United Health Foundation board member to join with all of you, healthcare businesses, our government and community leaders from across the state, to come together, to work together for the people of Louisiana. I am very happy. I'm happy to announce that the United Health Foundation is providing $500,000 to the Louisiana Cancer Research Center to help develop, thank you, develop a coordinated, statewide strategy that will improve cancer detection, cancer care, and outcomes for Louisiana. That financial support has helped produce the research and the analysis we need to identify strategies and create programs that will improve and save lives. The mission of the United Health Foundation is to build healthier communities, combining our knowledge, combining our experience and compassion to help improve the health of the communities in which we live and where we work. It is in partnership and collaboration with experts and leaders like yourself that help us fulfill our mission of helping people live healthier lives and making the health system work better for everyone, every single person. In addition, the United Health Foundation has also produced the America's Health Rankings, which has been tracking health outcomes for almost 30 years. As we have discussed today, Louisiana has the 4th worst cancer outcomes in the nation, as well as high incidence of risk factors, which include obesity and smoking, according to our 2017 annual ranking. But beyond the statistics and all the data, I would guess that every single person in this room has a connection, a personal connection to cancer. As a nurse practitioner, I know how prevalent and how devastating this disease is. Whether it is a parent, a spouse, a friend, a child, it has touched every single one of us. In fact, I recently lost my sister-in-law at 39 years old to colon cancer. It's personal. It's personal to each and every one of us, and the time is now. So it's with this level of commitment and in the spirit of our company's mission that I am pleased and that I'm excited to be your partner. We're honored to support this initiative, and we look forward to working with you and the great state of Louisiana. So I want to say thank you. Thank you to the governor.
Thank you so much.
And Dr. G.
We know that in Louisiana, and this has been true for some time, we've had one of the best tumor registries in the country. But we've got the 4th worst outcomes related to cancer in the country. The disconnect sort of speaks for itself, does it not? We can do better, and that's why I'm excited to be here. Cancer has in fact touched all of us. Whether we were a patient ourselves, the parent of a patient, sibling, child, friend, whatever, it's touched all of us. And while we get closer and closer to finding the cures that we're looking for, our greatest weapon remains early prevention. You know, a little over a year ago, I had a colonoscopy, my first, because I turned 50 years old. And I guess there was a silver lining to it because it was the best sleep I've had in my time as governor. The other great result was they actually removed 3 precancerous polyps. And what I know is if only I live long enough, that's cancer avoided. And so everybody ought to have access to that kind of care and diagnostic evaluation. Early detection and screening make a difference for me, but not everybody is fortunate enough to have access to affordable preventive care. And that's why I am so excited about some of the things we've done, principally Medicaid expansion, which for a total investment of $47 million this year by the state, we leveraged $1.85 billion from the federal government to provide health care that turns over in our economy and has an impact overall of $3.5 billion and is responsible for more than 19,000 employees across the state of Louisiana. All of that is great, but none of that is as important as improving our health outcomes in the state of Louisiana. With respect to cancer, I want you to listen to some numbers. Of the 472,000 working poor adults who've been covered, 23,400 have received screening for colon cancer. 7,438 of those had polyps removed, just like I did. And 314, unfortunately, were diagnosed and able to begin treatment for colon cancer. Julie, 41,034 women received diagnostic breast imaging because of Medicaid expansion. 391 were diagnosed with breast cancer and were able to start their treatment. Now, those are the two primary cancers for which we engage in large diagnostic evaluations. But we have every other type of cancer that is being treated in our Medicaid expansion population as well. Unfortunately, we're not able to diagnose most of those earlier, but because they are going to their primary care physicians more often, we are in fact diagnosing those too earlier. And this really gives people an opportunity, not just at a better life, but at life. Critically important. And as we look at the poor outcomes and where Louisiana ranks in cancer care, we have a real opportunity through the Taking Aim at Cancer initiative to make positive changes for the people of our great state. And so by convening this great group of leaders today, coming from all over the country and building our network for statewide support and commitment to this effort, we can change the course and improve the health of Louisiana citizens. And I've got Dr. Gee standing beside me. When I hired her, she understood her chief job was not counting the beans at the Department of Health. It wasn't anything else. It is improving the health outcome of the people of Louisiana. So we're here today also for an in-depth discussion on two cancers that affect a large number of people in our state. But also, we're already working on new approaches that we believe will make a big difference for our state. One example of how we can apply for grants for clinical trials from the National Cancer Institute Community Oncology Cancer Research Program. And like everything else, it has an acronym. It is known as NCORP. And we want to thank all of the folks here, especially Dr. Warder McCaskill-Stevens. She is the chief of the NCORP with the National Cancer Institute. She is here with us today and standing to my right. So thank you so very much. Critically important, NCORP extends the opportunity for providers to bring access to advanced clinical trials to patients. In the past years, two different groups in Louisiana have applied for and received grants for clinical trials. Now, through the leadership of these two groups and Dr. Gee, they're going to actually work together as one unified entity to build on each other's strengths, eliminate duplicative administrative costs, and provide more funding to work directly with patients who fight cancer. The combined NCORP seeks to increase access to clinical trials to more than 50% of cancer patients in Louisiana and to increase opportunities to compete for additional federal funding for cancer research in our state. But the collaboration will not end here. CEOs and presidents of health plans and health systems and other key stakeholders working on cancer throughout our state have been convening this entire year. And they will continue to work together to develop better strategies and ultimately implement new initiatives to strengthen cancer care and improve outcomes. Patients and their families and future patients receive the most benefit when we can work together, learn from one another, and pursue a better strategy. So today's gathering broadens that collaborative effort and will enhance our statewide cancer strategy because we need innovative solutions. It is unacceptable to have the fourth worst outcomes in the country. I believe it's 175 cancer patients a week that we're losing. We can do better than that. The great state of Louisiana is better than that. So our work is just beginning as we launch our statewide strategy to take aim at cancer in Louisiana. And a little later, you're going to break into groups to further discuss breast and colon cancer, and I encourage you to be fully engaged and share your expertise and your knowledge, but also share your enthusiasm and your commitment to this effort. I'm looking forward to learning from all of you and witnessing changes that are going to have a positive impact in our state, especially on the residents of our state who need it the most. So thank you all. God bless you, and God bless the great state of Louisiana.
A little over a year ago, because I turned 50, my doctor told me I needed to have a colonoscopy, which I did, and 3 precancerous polyps were removed. But that is a diagnostic evaluation and a treatment that should be available to everyone, which is why I'm so thrilled that the Medicaid expansion is making it available to that universe of folks, about 470,000 working poor adults in Louisiana, tens of thousands who've already received this screening, and about 7,000 or 8,000 of them, I don't remember the exact number, who've actually had precancerous polyps removed. And what we know is that's cancer's avoided. You know, for those patients, you just can't do better than that.
You also mentioned, real quick, you also talked about Representative Julie Stokes. You also talked about a member of your own staff. Can you talk about how you've seen this in your own personal life?
Look, as we speak here today, Ben Nevers, a dear friend, longtime public servant in Louisiana, my first chief of staff, he actually is recovering from surgery to remove a portion of his lung. That was lung cancer and some lymph nodes. And by the way, he's a non-smoker, so nobody should think that lung cancer is limited to those who've smoked. Obviously, smoking does increase the risk for lung cancer and exposure to secondhand smoke too. But Julie Stokes was in here, a member of the House of Representatives who was diagnosed and has been treated for and is still battling in some respects breast cancer. And so this touches every family, there's no doubt about that. And so as we pray for them, we also need to get about the work of producing better outcomes, doing what we can do. And if you think about having over 50% of cancer patients in Louisiana taking part in clinical trials and research that are designed to improve those results, that really is encouraging. I'm excited about it, and to have people from all over the country, the best experts in the country here putting this together, making sure it works, you know, this is a great day for our state.
Governor, as far as you know, is this the first time this collaborative effort has been partnership to attack cancer?
Yes. And Dr. Gee can mention this, but we've had a lot of disjointed efforts before. And that's not a knock on them. They were doing the best they could. It just wasn't coordinated at the high level where we need it. That's what we seek to change and to engage in best practices, but also as we move forward to avail ourselves of additional funding opportunities. There are grant dollars available both through the private sector, as we've learned here today, but also through the federal government. And so we need to bring all of that to bear here in Louisiana to produce better outcomes.
We've had fantastic providers, but it hasn't been a coordinated statewide effort to really think about earlier diagnosis, earlier screening, and saving lives from cancer. The Medicaid expansion that the governor brought to the state has changed the lives of hundreds of thousands of people. We've screened over 60,000 just for the 2 cancers we're talking about today, breast and colon. So message today is definitely, if you have not been screened and you're over 50, absolutely get your colonoscopy. If you're a woman and you're over the age of 40, you should be looking at getting an annual mammogram. You need to get your pap smear. Cancer at the late stages in most cases is preventable, so please get your screening. Medicaid expansion has changed that. The other piece is clinical trials, is making sure that every citizen who can get on a clinical trial is able to enroll in one, and working to create the partnerships that allow those conversations to happen between a primary care nurse practitioner, primary care doctor, and the specialists who do the cancer treatment and care. So it's an exciting day. It's about collaboration, and we're challenging them all to work together a little bit better than has happened in the past. This is everyone's problem. Everyone's impacted, and everyone has a piece in the healthcare system of solving cancer. It's something we can tackle and we can solve.